like our participants are popping in. Good afternoon, everybody. Thank you so much for joining us for our webinar today as we discuss a cancer that has a higher mortality rate in Appalachia than in most other places in the United States. So our speakers today are going to discuss the prevalence of lung cancer, the risk factors, the importance of early detection, and then how to screen for lung cancer in a new screening program, relatively new screening program called a low-dose CT, and how you can go about to getting one of those. My name is Danielle Harmon, and I will be your moderator for today's Health Talk. Before I jump into our speakers, I have to talk to you a little bit about our housekeeping items and about Appalachian Regional Healthcare. ARH is a nonprofit healthcare system operating 11 hospitals in southeastern Kentucky and 2 in West Virginia. We are the largest provider of care and the single largest employer in southeastern Kentucky and the third largest private employer in southern West Virginia. We operate multi-specialty physician practices, home health services, home medical supply stores, physical, occupational, and speech therapy, and retail pharmacies. Our mission is to improve the health and wellness of the people of Appalachia, which is why we have events like this, webinars and in-person events and all kinds of good stuff for our communities to try to fulfill that mission. The Q&A section is going to be open throughout this webinar. Please feel free and comfortable in using that Q&A section or the chat box. And as with most of our webinars or all of our webinars, we cannot give referrals or specific medical advice to participants. We do have an array of providers that should be able to help you on arh.org, and we encourage you to go find a provider and make sure you always get your preventative medicine taken care of. In lieu of reading the bios for our speakers, I hope that we could all just introduce ourselves, talk about the roles that you play in cancer, and then maybe why it is a passion for you. So Jennifer, you're the very first one on my screen, so do you mind going first?
Sure. My name is Jennifer Wilson, and I am a regional cancer control specialist for the Kentucky Cancer Program. I cover all of the Big Sandy area, as well as the 5 region of Eastern Kentucky. And I've been in this role for almost 4 years now. My mom is a cancer survivor, and but long before that, my grandmother was diagnosed with cancer when I was a teenager. And so I've seen that and seen so many people that I love have different types of cancer, whether that's breast, colon, or lung cancer, like we're talking about today. And so, you know, the 2 things that we can do to affect change in someone's life is to improve their health and their education. And that's exactly what we're doing today, is educating them on why it's important to talk about the screenings as well as the signs, symptoms, and risk factors.
Perfect. Thank you. Ashley?
I am Ashley Teague, and I'm Jennifer Wilson's counterpart in the Kentucky River District. So I'm based in Hazard and cover all the surrounding counties here in Eastern Kentucky. And I would say I'm passionate about cancer. Well, I fell into a job in the cancer world almost, oh my gosh, it was probably 12 years ago now. And I got to meet cancer patients firsthand, and I loved my job. But it was so emotional because I watched these cancer patients have to battle this disease every single day. And then I learned about the Kentucky Cancer Program and how we are on the flip side of cancer. So we want to make sure people are getting screened so that they can catch cancer early, or they're doing everything they can to prevent cancer in the first place. And so that's why I'm just very passionate about it, is because I've seen those people, and even in my own family, fight that fight, and it's such a hard battle. And so if we can do anything to prevent that or make that as easy as possible, that's what we want to do.
Thank you, Ashley. And lastly, we have Rochelle.
Good afternoon, everyone. Thank you for joining. My name is Rochelle Waddell. I'm a nurse here at ARH. I am the lung cancer screening navigator for the ARH system. I became a nurse almost 17 years ago. One of my first positions was a nurse on oncology. So I saw the effects of cancer. And when this job became available almost 2.5 years ago, it was something that was important to me to take a look at how to do prevention and to get patients before that they're so sick that you cannot take care of them. So that was a goal of mine, was just to try to bring more awareness for prevention and try to help those patients in recognizing so that they do not get as far as being in the hospital and having to do treatment. So, you know, I feel like if you save one life, you've done a good job.
Thank you so much. And so I believe that we're going to share the presentation from Kentucky Cancer Program now, so they can talk a little bit more about lung cancer, the risk factors, what to look for, and then any kind of prevention that we can have. And then Rochelle will take over in the end and talk about low-dose CT and how we can go about getting a low-dose CT if we qualify. So Ashley, I think you're up.
Yes.
Can
Okay.
can you all see
You
that
can go to the next slide. Yes, it's good. There we go. So what is lung cancer? And of course, we're not going to go into a big medical description of what lung cancer is. Ultimately, it's just when cells begin to grow out of control inside of the lungs. And so lung cancer, in my experience, is usually a late stage diagnosis for most people, and it's after it's already spread outside of the lungs. And so a lot of the times it will, well, all the time when it spreads, it will go to the lymph nodes, and then it will mostly go to the brain. And so when I worked at the cancer center, gosh, it's probably 8 or 9 years ago now, every lung cancer patient that we saw was already 4th stage lung cancer. And so that's one of the reasons we do these kinds of awareness and education events, is because we don't want that anymore. We want people that if they develop lung cancer, we want to see it when it's still in the lungs and it's still very treatable. Okay, next slide, Jennifer. Okay, so there are 2 main types of lung cancer. And so you may have heard this before, just when people talk about it. It's small cell and non-small cell. And so these are just types that grow differently and they're treated differently. So it's very important when someone is diagnosed with lung cancer to know what type it is. And once the oncologist knows that, they know how to treat it more appropriately. And so non-small cell lung cancer is actually the most common, which is about 80 to 85% of all the diagnosed lung cancers. Next slide. So this is a map of Kentucky, lovely bright colors, and that's what we do not want to see. And so we have it broken down by county, and obviously the darker red that you see, those are the higher rates of lung cancer. And you will see in Appalachia, there's a lot of red. Lung cancer is one of the top cancers in this area, as I'm sure most of you all are aware. It affects a lot of people that we know, our family, our friends. But one thing I would like to say, without going too much into detail, is that here in our area, we actually are starting to increase our screening rates of lung cancer. So I hope, well, you may see that we find a lot more lung cancer, but we hope that we catch it before, it does any kind of damage. If you go to the next slide, you'll see why. Like I mentioned earlier, most everyone we saw in the cancer center was stage 4. And at that point, it's just not treatable, really. And so that's why this map will show you the mortality rate. So these are the people that are dying from lung cancer. And again, the dark blue in Appalachia, that's showing the high rates of this. And so one good thing is if our screening rates continue to increase, you will see the colors on this map start to get lighter. And that's what we really want to see, because lung cancer has long been one of the top cancers, not only in Kentucky, but in Eastern Kentucky. And so anything we can do to bring that number down or to prevent that even, we hope we can do that. And so Jennifer Wilson is going to go ahead and talk to you about some signs and symptoms of lung cancer.
Sorry, I couldn't find the mute button. Yeah, so like Ashley said, a lot of when you look at the state as a whole, a lot of our area and ARH's area we're in that red or the dark blue, and that's not where we want to be. And like she also mentioned, a lot of the lung cancers are being diagnosed at a later stage. So not the early, easier to treat stage 1 and 2. It's more 3 and 4 when it's spread outside of the lung area. And so that's going to tie into what we talk about here. The next thing we're going to talk about are the signs and symptoms of lung cancer. And you can see here, it's coughing, that nagging cough that just can't go away, or that's getting worse. And it's not a cold or something that you just can get over. It's something that's kind of stays with you and consistent. Chest pain, wheezing, coughing up blood, feeling very tired all the time, and then weight loss without trying or no known cause. So a lot of these signs and symptoms are things that you may have for another reason, whether you're a smoker or have COPD, you've been diagnosed with that. A lot of people with black lung in our area may have these symptoms. So they're not as concerned because it's something that they've been living with probably for quite some time. So they're not really thinking, oh, this is lung cancer. So they're putting off, just because we have these signs and symptoms, they're not looking to go get a screening because it's something that they're living with, they're used to having. So that may be the reason why we're seeing lung cancer diagnosed at a later stage at 3 and 4, because these signs and symptoms are things that people may deal with regularly because of other health related things. So the next thing we're going to talk about here are our risk factors. As you know, not just for lung cancer, but for all cancers, smoking is the #1 risk factor for lung cancer. Also, secondhand smoke. And we're going to talk a little bit more in depth about that because it is such a big cause of cancer, but also radon in the home or in the building that you may work in is the second leading cause of lung cancer. And a lot of people don't know a lot about it. I know before I started with Kentucky Cancer Program, I wasn't really familiar with radon and how it affects the body, and also how prominent it is in certain areas of the country and in our area of Kentucky. Another thing is other substances can cause lung cancer. So like I said, buildings that people work in or live in. So you're thinking asbestos, arsenic, diesel exhaust, silica, and chromium. So a lot of times people's jobs, the work that they do for maybe 10, 20 years can really affect them and their risk for getting lung cancer. Personal and family history. If you're a lung cancer survivor, there's a risk that you may develop a different type of lung cancer, especially if you smoke. Your risk for lung cancer may be higher if your parents, brother or sister, or your children have ever had lung cancer. And this can be true because they smoke, or because you live or work in the same areas, or that you've been exposed to the same things such as radon that can cause cancer. And then also radiation therapy on the chest. Cancer survivors of other types of cancer that may have high doses of radiation may develop lung cancer later on. And then your diet. We're seeing more and more how much our diet and the food that we consume plays a role in our long-term care, not just, oh, we've got indigestion or something like that, but long-term effects of it. And so scientists are studying many different foods and dietary supplements to see whether they change the risk of getting lung cancer. And they're, like I said, doing a lot of studies on that right now, but they do see that diet can play a role in your risk of getting lung cancer. So like I said, we're going to dig a little bit deeper on the top 2 risk factors. #1 being smoking and secondhand smoke. In the US, cigarette smoking is linked to about 80 or 90% of lung cancer deaths. So you think if we could pull out all of the tobacco use and smoking, what a different color that last chart that Ashley showed with that blue. That's what we're really concerned about, is the mortality, the deaths that are caused by lung cancer. And if smoking and cigarettes causes 80 to 90% of that, what a difference that's going to make on that. Tobacco smoke is a toxic mix of over 7,000 chemicals, and at least 70 of those are known to cause cancer. I used to work at a local health department and did tobacco cessation, and I always wanted to put a sign that says, warning, 70 cancer-causing chemicals in this office. And people, if you knew that, you wouldn't walk into an office that you knew had 70 cancer-causing chemicals, but the chemicals are actually in their pocket for the cigarettes that they, were carrying with them. So it's something to really think about. If you knew something had 70 chemicals that cause cancer, would you expose yourself to that? And so that's what we really are looking at when we're talking about cigarette smokes. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who don't smoke. Besides lung cancer, cigarette smoking can cause mouth and throat, esophageal, stomach, colon, rectum, liver, pancreas, voice box or your larynx, trachea, bronchus, kidney and renal, pelvic, urinary bladder, and cervix, and acute myeloid leukemia. So those are all cancers that are known to tie to smoking. And I know that smoking is something that is so difficult to quit. My dad just became a non-smoker last year after 56 years. So, I mean, it is a challenge. It's not something that we take lightly. Here at the Kentucky Cancer Program, we offer a program called Freedom from Smoking that really meets people where they are, whether they're, ready to quit tomorrow, or if they're just interested in how it's affecting their health and what options are out there to help them. And there's so many FDA nicotine replacement treatments available, and we go through those, whether that's a prescription, a patch, gum, or lozenge. There's a lot of things out there that can help people become tobacco free, and that's what our goal is at KCP with our plan to be tobacco free. So if that's something you're interested in, you can always put a note in the chat in the question box and we can get that information to you. We also want to talk about secondhand smoke. When someone breathes in secondhand smoke, it's just like they're smoking. We know a lot of people have developed lung cancer that have never smoked but worked in an area that was not smoke free for years and years. And that's why a lot of counties and cities have done a big push to become tobacco free, to protect those workers who may be in an enclosed area. And it says 1 in 4 Americans who don't smoke were exposed to secondhand smoke in 2013 and 14. So 25% of people who are not smokers themselves are exposed to secondhand smoke. Next, we want to talk about radon. I have this little infographic from the CDC. It's a great resource. We use this a lot in our work with KCP. So like I said, radon is the second leading cause of lung cancer in the United States. It's a naturally occurring gas that forms in the rocks and soil and water underneath your home. So if you have cracks or holes in your house, it can seep up, and then depending on the ventilation of your house, it can actually get trapped in there, which can cause problems. There is programs throughout the state through Kentucky, as well as partnering with the health department, where you can get free radon testing for your house. If that's something you're interested in, I know we do a lot of outreach with that and try to get people in contact with a radon test for their home as well. But it's really difficult to know unless you do one of those tests, because you can't see it, you can't smell it, and you can't taste it. So there may be radon in your home for years and you not be aware of it. It's estimated that the radon causes about 21,000 lung cancer deaths each year. So, we put a lot of emphasis on smoking and tobacco use, as we should, but also it's very important for us to look at radon as a cause of lung cancer. And then for those people who smoke in a home that also has radon, their risk of developing lung cancer is drastically increased because those particles bind together when they're being inhaled. So you can see here on this little infographic that it shows how radon comes from the ground and can seep in through your basement and then into your house. That 1 out of 15 homes has a radon level that's too high. And you say, well, what's too high? And so down here that you can see the little arrow, and that it's measured by PCIs, and the World Health Organization recommends that at a level of 2.7 that you take some type of action, but the EPA recommended is at 4. So I know that we have seen some studies done around here. It was actually a bunch of students in the Perry County, the Hazard area, that had did a great poster study on the homes in their area and how many still had that high radon level. So like I said, you want to be able to get that test, the radon test, to see where those levels are. And then if you do smoke in your home and you have radon, you are 10 times higher, have a risk 10 times higher of developing lung cancer. So like I said, if you don't use tobacco, that's wonderful, but also you need to be looking into your home to see what those radon levels are. Finally, what can we do to prevent lung cancer? You know, that's like Ashley said, with KCP, that's a big push of ours, are preventions and screenings. And so Rochelle's going to talk a little bit about screenings after we finish here, but what can we do to prevent it? Number one, don't smoke. We're saying don't smoke cigarettes, cigars, pipes. There's been a big push, you know, with the vapes and stuff that's become in the forefront right before COVID hit. That was the big topic. It's still there. It's still an issue. So we want to encourage people not to smoke any kind of tobacco or nicotine product. Like I said, we offer that Plan to Be program. There's also one called Freedom from Smoking that's offered through a lot of health departments. There's also tobacco treatment specialists that are offered through a lot of area, whether that's through KCP or hospitals or health departments. There's some tobacco treatment specialists in your area as well. Avoid secondhand smoke. So if you know somebody that smokes or you're going somewhere where they do smoke, you know, ask them to smoke outside or somewhere where you can avoid that. We want to test our homes for radon if you haven't already. Avoid carcinogens at your workplace. Eat a diet full of fruits and vegetables, and exercise most days of the week. You know, with this time change, it's getting very difficult to get outside and do some things, but there's some great opportunities to do some exercise at home. There's free videos on YouTube or Zoom classes and stuff that you can do if you don't have a gym or the time to do it outside. So those are the things that we really recommend moving forward to look at preventing lung cancer. And like I said, I'm going to turn it over to Rochelle, and she's going to talk to you about the low-dose CT. It's a screening that we really recommend for people for lung cancer. My dad, like I said, he was a smoker for 56 years. He has a low-dose CT. So I'm going to turn it over to her and let her tell you a little bit more about that.
Thank you so much, Jennifer. Let me see if I can get my screen. Okay, I'm not sure what just happened, but
We can see it. Michelle.
okay. All right, and so you can see it?
Yep.
Perfect. So again, my name is Rochelle Waddell. I'm a nurse here at ARH for our system center. For system-wide, low-dose lung CT is what I focus on. The screening, lung cancer screenings, getting those patients to do low-dose lung CT scans. So just a little bit about lung cancer screening in general. So on the computer, it shows lung cancer screening is looking for cancer before a person has any symptoms. And Jennifer and Ashley just did a wonderful job on describing those symptoms and what to look for. This can help find cancer at an early stage. When abnormal tissue or cancer is found early, it may be easier to treat. So by the time symptoms appear, cancer may have already begun to spread. So screenings with low-dose lung CT scans has shown to decrease the risk of dying from lung cancer in heavy smokers. And screenings from chest x-rays, as you can see on the screen, there's a chest x-ray versus a CT scan, does not decrease the risk of dying from lung cancer because a low-dose CT scan will pick up a lot more than what a chest x-ray will. So lung cancer screening, low-dose lung CT scans is a CT scan that provides an image of inside the patient's body with minimal radiation. This reduces the risk for patients by limiting overall radiation exposure in association with the medical imaging study. So basically you're getting a low radiation scan that could help save your life. A low dose CT scan is a non-invasive medical imaging test that is used for early detection of lung cancer. If lung cancer is detected at an early stage, it is more likely to be cured with treatment. So lung cancer screening low dose lung CT scan is an annual screening unless something is found, and then at that time, more recommendations may be made. CT lung screening is a non-invasive, painless procedure that uses low dose X-rays to screen the lungs for cancer in just 30 seconds. A CT lung screening allows the radiologist to look at different levels or slices of the lungs using a rotating X-ray beam. It is performed on a multi-slice spiral CT scanner and can detect smaller nodules or cancer that standard test X-rays cannot. So the big question is, how are you eligible for a lung cancer screening low-dose lung CT scan? Per Center for Medicare and Medicaid Services, CMS, the current criteria is persons age 55 to 77, asymptomatic, which means no signs and symptoms of lung cancer, such as new shortness of breath, coughing up blood, fever, chest pain, unexplained weight loss. A tobacco smoking history of at least 30 pack years. So that's 1 pack year equals smoking 1 pack per day for 1 year. So it's 1 pack equals 20 cigarettes. So for example, you smoke 30 years, 1 pack a day. That is a 30 pack year history. So it's got to be 30 or more pack years. So if you smoke for 15 years and you smoke 2 packs a day, you're at that 30 pack year mark, and you would qualify at that point. You have to be a current smoker or one who quit smoking within the last 15 years. So if you're a current smoker that smoked for 30 years, 1 pack a day, or if you've quit in the last 15 years. You also have to receive a written order for lung cancer screening with a low-dose CT. Written orders for lung cancer low-dose CT screenings must be appropriately documented in the beneficiary's medical records. So all that means is that when you follow up with your provider, if you mention that you would like to do a lung cancer screening low-dose CT scan, at that point, the provider will go over with you what the scan is, that it's an annual scan. That will give you an opportunity to ask more questions, to give feedback, and the doctor can write that order for you to get that scan. So low-dose lung CT scans are available at all of our ARH locations. That's 13 facilities. So we are able to schedule you at your convenience at the closest location when you're able to go. And that just shows our locations of our facilities. So there are 11 facilities in Kentucky and 2 facilities in West Virginia that we also do low-dose CT scans for. And this is just some contact information for me. So if anyone has any questions or would like to contact me, please feel free to reach out. Also, you can visit our ARH website at www.arh.org. It has some more information on it also.
Thank you so much, Rochelle. Do you mind to stop your screen share? I'm going to put us in grid view so that we can have a little Q&A if you guys don't mind. We have a question, and it's in relation to vaping. Of course, we have a huge vaping epidemic that has taken over the past few years, especially with our youth. But the question is, can vaping and e-cigarettes cause lung cancer just as tobacco does, tobacco use? Jen, do you want to take that question?
So that's a lot of studies are being done on that now. Vaping and e-cigarettes are fairly new in relation to cigarette smoke. We've been able to study that for 60 years. So they're looking into that to say, what is the risk? But they do know that inhaling any type of chemical like that, like I said earlier, asbestos and all of those chemicals that I had listed on our slide are things that have been found in e-cigarettes. And so Juuls and any type of vape. So all those things are being found in e-cigarettes. And so you're inhaling those into your lungs. You're heating it up and putting it into your lungs. So they are studying that right now to see exactly what the risk is compared to cigarette smoke. But yeah, those chemicals, the same ones that are causing lung cancer, whether that be through work or they're also in cigarettes, those are the same things being found in vapes.
I see. So we're basically the guinea pigs right now for the studies that will come out, 50 years
Yeah.
from now about vaping, just as they did before for tobacco.
Exactly. So, they started doing the first studies on tobacco and cancer in the 50s and 60s. They knew it caused cancer, but we weren't really, people didn't really latch on to that information until the 80s. So, we're in that first trying to learn and link up right now with the studies.
Thank you so much. So next, I'm going to give this question to you, Ashley, if you don't mind, but it's radon causes, I know we said 21,000 cases or so per year of lung cancer. How do we acquire testing for radon? I feel like a lot of people don't really know that that's a cause of lung cancer or don't understand how they would get their house tested.
Well, and I was like Jennifer, I didn't know about radon until I came into this job, and part of our job, is to educate people on ways to prevent. And so we learned about radon. And actually, so I am in Hazard, and I'm sure this is true for a lot of Eastern Kentucky, is that health departments have radon kits that they will give to you for free to test your home. And I actually tested my home a few years ago after we first really started a push with radon testing. And I mean, super simple test. It's this little black sponge looking thing that you hang in the lowest livable space of your home. So I put it in my basement next to my washer and dryer. And so you leave it there for I think it's 24 to 48 hours or something like that. Stick it in an envelope and mail it into the state. And then they will send you back a report like what your levels were. And I think my level was like 1 point something. So it wasn't anything to be worried about. The state has a radon program as well. I don't have that contact information right off, but you can Google that.
I'm going to put that in the chat. I looked it up for you, Ashley. Yeah, it's through the state on how to order a free radon kit. So I'm going to
and you can
that
actually get radon kits also at like Lowe's and hardware stores. So it's easily obtainable. And I will say back to what Jennifer was talking about with the students at Perry Central did the big research project on radon in Perry County. I was very surprised with the results that they found, because where I live in Perry County, my house didn't have a high level, but some of the homes that they tested had really high levels. And so I almost felt like there was no madness that just because I had a low level doesn't mean that someone down the road would as well. So that's why it's important that everyone test their home.
Thank you so much for that. So my next question, Rochelle, this is going to come to you, I believe. So how long has low dose CT been around, and what kind of change have we seen since this new screening program?
Low dose lung CT and lung cancer screening really started up in 2012. CMS didn't adapt for a year or two later as far as recommendations and catching on to the lung cancer screening. So ARH has been doing lung cancer screening since late 2016. That's when we started our program. And I think that year, it was in November, we did 16 lung cancer screenings. And that was in, like I said, late 2016. Early 2021, here it is, 5 years later. This year, we're going to do 1,600. So yeah, our screenings, I'm very proud of our patients in our communities for taking initiative and getting out to do those screenings and attempting to do their preventive care. So I'm sorry, I forgot the next question.
Oh, that's okay. I was just going to say, what kind of change has it made for our patients, or just for the population in general, not just for ARH patients, but how the lung cancer rates have dropped, if you have any information on that, since low dose CT has been around?
Since it began in Kentucky around 2012, our rate for lung cancer screenings have increased. We're actually number 2 in the nation to do lung cancer screenings, which sounds good, but it's still at a very low percentage at around 11%. So there is still a lot of work to be done for lung cancer screenings in general across the nation. Kentucky at one time ranked number 1 for lung cancer. I recently saw something posted that we were close to being number 2 now. You know, we don't want to be ranked number 1 for lung cancer screening. Basketball, maybe. Lung cancer screening, lung cancer, not so much. So I feel like that we are headed in the right direction. But, you know, it's like anything else. It has taken time to make sure we're getting the education. And I do want to say there is a change coming for the screening criteria with some new recommendations that is hopefully going to be adapted by CMS in late February of 2022. And so stay tuned for that information, and we will get all that updated, and it's going to be a little bit more of a range to get more patients screened.
Perfect. Thank you, Rochelle. And this also, I'm asking for a percentage, so I know some of you may have it and some of you may not, and I apologize for asking this late notice. But I know that a big majority of our lung cancer patients were actually asymptomatic. Do we know how many or what the percentages of people that are actually asymptomatic with lung cancer, so we can talk about the importance of getting this low dose CT screening if you meet that criteria? Does that make sense? Hope I didn't confuse anyone. Okay.
It does make sense, and I'm going to take a little bit of a stab at that. Majority of the patients, I'm proud to say that out of 1,600 patients that we are going to do this year, you've probably got maybe 50 patients that needed follow-up, which means that there was something recognizable on a scan, or there was in question, or needed some kind of follow-up. So it's going to be a higher percentage that we've done screening for patients that still continues with the screening and they have found nothing. Now, a correct percentage, I would be afraid to say.
Sure. So are all nodules that are found in the lung always cancerous? That's another question that will come through beforehand. Or it's phrased, are nodules found in the lung always cancerous?
Nodules found in the lung are not always cancerous. What I've discovered doing this in the last 2.5 years, there is numerous reasons that nodules show up. So that's why it's always important to continue, if you start with lung cancer screening or any type of screening that is, to continue the screenings, especially if they say, hey, we found a nodule, but we want to watch it. We want to do another one in 6 months. Please get that follow-up in 6 months. Because with a nodule, it's just, I'm going to kind of compare it to colon polyps. Those polyps tend to turn into something cancerous over a period of time. So that lung nodule could potentially turn into something cancerous if it's not at the beginning. So lung nodules are not always cancerous, but it is something that you need to continue to watch.
Thank you, Rochelle. So I think let me check Q&A really quick. I don't think we have any other questions. So that really ends our health talk today. Thank you, Jennifer, Ashley, and Rochelle, for your time. Really appreciate it. And I need to let our participants know also that if this is an incentivized webinar, of course, thank you for your participation, but we're also giving away an Apple Watch for participation, and we will be raffling that off. So please make sure that when you registered, you gave us your correct mailing address and contact information. If you feel like you did not do that, you can shoot me a message at dharmon@arh.org, and I can get that fixed for you. Otherwise, have a great rest of your day, and everybody else stay safe out there.
Thank you.
Thanks, guys.